Okay, so let's get started. Firstly, I would like to thank all the panelists for accepting this invitation to join this panel discussion. The panel discussion is technology at the time of COVID. Did it really create a digital divide? And how did we respond to it? So, to kickstart this conversation, I'll take the first minute to introduce each of our panelists, and then we go into the questions. So let me first introduce Ashoka Fellow Nalini Saligram, founder and CEO of Aarroga World. She leads and she founded a global health nonprofit committed to changing the course of chronic disease. All her work is to prevent non-communicable diseases through health education and lifestyle change. So she follows a doorstep health model, tackling prevention model, so that people can really take care of this issue. So that's Nalini. Our second panelist is Abhinav Agarwal, the founder of the Anahad Foundation. And Abhinav's work is all about preserving India's folk music traditions by using technology to record the country's folk musicians, acting as a record label, producing unheard music from the musicians from across India's tribal villages. Anahad releases songs directing all royalties back to the musicians and raising the economic livelihood of those underprivileged, musically talented regions in which labels work. So that's our two panelists from India. The other two panelists are from Indonesia. We have Ibu Yuni from YPK Bali. YPK Bali integrates rehabilitation and education for the disabled people to improve their lives as equal citizens. Having reversed the traditional belief about disability as a family disgrace, YPK Bali has been able to convince parents not only to let their children go outside, access rehabilitation therapy, but also to get education and seek rehabilitation therapy at home. Our final panelist is Mas Gandhar from Kampala. Kampala has been around for a really long time, and as most of you know, Indonesia faces some serious disasters year on year: earthquake, volcanoes, tsunamis, and now COVID. But I don't think COVID was part of their plan. But Kapala is a community owned organization that helps communities live with natural disasters and what they should do when natural disasters happen. So that's our lovely panelists, Nalini, Abhinav, Ibuyuni, and Maskanda. Welcome. So this is my opening question, and this opening question applies to all of you, right? So let me start with Nalini. Nalini, it will be good to understand who is your target beneficiary and what are the challenges that you faced as COVID hit, and how did you bring in technology to pivot during COVID? Nalini, over to you.
Thank you, Rajesh. Thank you very much for including me on this panel. It seems like it's going to be a really great discussion. I look forward to the stories that you're going to unearth. We are a chronic disease prevention. Aarroga World is our name, and we are a chronic disease prevention organization. We work in India, all over India. So our target beneficiaries are people of different age groups because we take prevention to people where they live and learn and work. But let me focus on the schools program and where we target adolescents, 11 to 13 years old, middle school children from government schools and private schools from north, south, and all over the country. And we chose this age group because we wanted to impart health education to them before their lifestyle habits were set. And we did that by there's another reason that we have data that the children are more and more of these age group kids are pre-diabetic. 10 point something percent are known to be pre-diabetic in India, and 3 out of 4 of these teenagers are not having enough physical activity. They don't go out to play. So we wanted to make compelling games and activities for them that would teach them in very interesting and fun ways about health and healthy living and help them make those choices. So we, but then COVID hit. We had reached 300,000 school children all over the country working with multiple partners. And this is designed to be taught in the school setting. But then COVID hit, schools are closed, and we didn't want that an entire generation of middle school children not to get health education at the time that they needed. So we accelerated our digitization program and plans, and we wanted very much to find a tech vendor who would get us retain that compelling nature and interest level of the kids in the digital world as well. So we're working with Zobel, and we have created a digitized material, and we'll have it ready in 4 languages by December. The games are like snakes and ladders, for instance, where a bag of chips may be a snake and an apple is a ladder. That's a lesson that child will never forget, especially when they play it. We hope to use this digitized program to take it to hundreds of thousands of children in Maharashtra and Uttar Pradesh. We've started conversations in that regard, but we are working very, very hard to overcome challenges like data collection, like internet access, and a lack of availability of these phones for the children to use. So we're working through all that, but we will use a government portal called Diksha to house all our digitized material. So there is a lot of exciting next steps for the middle school children with our program.
Thank you very much. Thank you very much, Nalini. Thank you for your optimism and how quickly you responded to the challenges of COVID. So exciting times ahead for you. So let me move on to Abhinav. Abhinav, you work with folk musicians, and they live in, I believe, the villages of India. I'm not even sure if those villages have access to internet. So when COVID happened, can you tell us a little bit more about your target beneficiary? What kind of lives do they live? What challenges, and more on that?
Yeah. Our target beneficiaries are folk musicians, and especially who are below poverty line, who live in rural and tribal areas. So I'm a musician myself, and also I love music. So whenever I have to listen, I feel like listening to music. I open Spotify, and shuffle through the playlist, and I find my music and just listen to it. But hardly you will find any folk music content, like real raw folk music content, in any streaming platform like Spotify, Apple Music, anywhere. That's not because musicians don't like to produce and put up their content. It's basically because technology, it comes with a cost. To do a simple recording in a studio, it costs around, say, 8,000 rupees uh, for a simple recording, and then you have to do a proper editing and mastering. So normally, all these folk musicians, they are not able to afford the cost of producing their music and creating an album. So what we did in Anhad, we created a portable studio that we call as Backpack Studio. It operates on battery, and we take this studio at the doorstep of folk artists. We set up there, and we create free music videos and albums for these artists. Uh, when COVID hit, uh, the the main problem was all the live shows that were happening because of the tourism. Uh, they were not happening anymore, and all the artists went unemployed. Uh, and this was mainly because of the lockdown. So what we did during this COVID time, we created a live online series, which we called as Chaukhut Ki Goonj. We asked artists that they don't have to step out from the boundary of their house, which is the chaukhut, the main door. They have to sit with their family members, and they have to play a song for 30 minutes. So we invited these entries, and every day we were getting more than 2,000 entries, these music videos. And for every musician, we were paying 1,000 rupees, and we were giving them a ration kit. So this was just to these are just a temporary relief that the artists were to give artists a temporary relief for 15 days, so that artist is able to think that what he has to do next, during this COVID period, because the situation is different from every village, and we can't be the ultimate person sitting over here in Delhi and design a solution for them. So we thought that we'll provide them some ration and some financial support, and let the artists decide themselves that what they have to do next. this was the measure that we did during this time.
No, thank you very much for sharing, Abhinav. I know it must have been really hard, but thank you for continuously championing the lives of folk musicians. So moving on to our Indonesian panelists, Ibu Yuni and Mas Kandar, would love to hear your perspectives. Ibu Yuni, you work with a difficult target group. What happened?
So yeah, YPK Bali, since it's established, is dedicated its program to support both children and adults with physical disability. But however, we prioritize our beneficiaries to babies and children as our main beneficiaries. So when the COVID hit uh, the world, it has also affected our programs. The last 8-9 months were tough times for us in YPK Bali, as well as for people that we help. It affected our programs operation. It forced us to close our clinic, to close our schools. We have to stop our outreach program. We cannot go to the village to deliver the services, and some collaboration with our partner also interrupted. So our team has to adjust to the pandemic situation very quickly. We have to transition our program's service model into a remote surveillance system where before the pandemic, the program's services was run direct with the direct interaction with the clients. But since the COVID hit, we have to stop to do it. And all the program activities are done at home, which is also highly reliant on the parents and the especially the family members. So it's really changed the way we deliver the services. So the challenge it's obvious that we have to keep them to be motivated, to always to be supportive, and for YPK Bali staff also to always to be creative in terms of developing a therapy plan so they can easily understand, and also modeling at home. And we continue to open communication with the family member. So speaking about the challenge, we also try to ensure that each client gets support from the family member, especially those clients who are under 15 years old. They really need parents to be with them doing the home exercise program. So we have to be flexible in terms of the service hours, and to be creative in terms of the therapy equipment that they can find and use at home. For example, how they can use a bamboo or wooden board so they can doing the walking exercise and strengthen their upper and lower limbs. So things like that. And as I mentioned before, that we have to establish strong communication with the family member, because they play an important role to do the monitoring, everyday monitoring on behalf of the YPK physiotherapist. So for the monitoring, usually they send us pictures, videos, or even a short message showing that what exercise they have done at home, what the challenge and what the success they find at home. So together we can continue to do the home exercise safely and in the most meaningful way for them. So yeah, that's kind of the challenge and the changes that we do after the COVID hit us in YPK Bali, Rajesh.
Okay, thank you, Ibu Yuni.
Yeah.
Before I go to Mas Kandar, dear audience, you would have got a gist of the work that our panelists do and the target audience and the challenges that they are facing. So please use the chat box either to extend any kind of support, or you have any questions, please do. I think there's a question from Gitika. I don't know, Nalini and Abhinav, if you think you could help with that question, please use the chat box. Okay, Mas Kandar, over to you. Your organization is all about preparing the community for disaster, and you work with volcanoes, tsunamis, earthquake, name it all, and floods, right? And then came an invisible enemy, COVID-19. So how did you help your community navigate this crisis?
Yeah, since 1994, Kapala is already focused on the community living in the disaster-prone area and the area with the disadvantage such as environmental degradation, remote place, and the far from the public access. And how to imagine the COVID-19 is actually being in the emergency. We couldn't imagine that people evacuate with following the COVID-19 process. So in the process, we must follow that fulfill the community need. We fulfill that communities having a double risk. They're already having their annual disaster that occur in their area, and also how to adapt to the COVID-19. So in this kind of the condition, we must focus on the preparation to the emergency situation. Because first, because in the context of the planning and preparation of the community itself in the traditional practice without COVID is love to be social gathering. They love to meet. Even even in this context of COVID, it's very hard for everyone to gather and discuss in the planning of the emergency. So we must be fulfill the condition of this condition. We making the community to live with the technology. We make the community must be using technology that they rarely use the technology for the gathering because they living in the rural area. It's easy for them to meet their neighbor, and so this the condition they must be adapt to this kind of condition. So when the annual disaster occur, not the COVID-19, but the kind of the volcanic or even the landslide, so the community could do the emergency situation. They could fulfill their basic needs without having a double risk of the COVID-19. So they must fulfill the social distancing in the evacuation process. They they must be accustomed to the digital meeting. They must be making the preparation of the contingency plan for the next kind of the process was the step of the emergency planning. So this how to community respond to the COVID. So when the COVID is occur, they also must have the exit plan. So when the emergency is occur and the landslide is occur or the volcanic eruption is occur, they must be having the COVID-19 preparation in the context. This the new thing that doesn't occur in the last year or even the in the past from the our experience. So this a brand new idea for everyone that living in the community in the disaster area. This, thank you.
Thank you, Masganda. I think you said a very valid point, right? At any crisis, it's the community that comes together. But in COVID, you can't bring the community together, right? It can increase the infection. So it's very interesting how you're thinking of exit plans. Thank you very much. Okay, so over to you, Nalini. Thanks for sharing the education plan that you have and the fact that you're reaching 300,000 kids. So now we are living in a COVID world. We are living with technology. It has shifted the way social impact organizations run programs. So, what is the future for you? How are you seeing technology play an important role? How are you going to shift the mindset of the people that you're working with? Share a little bit about your future.
Sure. Thank you. So I had talked about the schools program where we are, targeting adolescents, but we have other programs as well. So we have young professionals that we work with in companies. We have benchmarking criteria for companies. We take through social media tools like Maithali to urban women, and we have a variety a text message program that we take diabetes prevention text messages to consumers all over the country, including at the base of the pyramid. But what we are trying to do in the future is actually finding ways to build a platform that we are calling a Aarroga wellness platform that will help us reduce costs, expand reach by working with different partners, and also streamline all our operations. So to give you just one quick example, in our healthy workplace program, we want to automate our training, digitize the training instead of doing everything offline one by one, also our assessments of the different companies. And we want to produce a HR dashboard so that the human resources manager can get a quick finger on the pulse of the health of the employee population. Um, in our text message program, we want to increase engagement with those messages. So we are looking at WhatsApp. We're also looking in general at artificial intelligence and increasing the possibility of behavior change, getting more compelling work done with nudges and other aspects of AI. And we are going to be sitting on so much data that we want very much to understand what to do with mining all that data. We will have health data from millions of people in a year or two. So we want very much to understand what to do with that. It is a lot of very valuable data that we'll be sitting on. And the other thing is data collection itself, analysis itself, we want to streamline. So that is another reason why we want to move to technology and accelerate that in this time. And finally, we would like, it's my wish to, use something like Aadhaar Stack and actually increase or provide free or subsidize fruits and vegetables for a lot of people. This would help smallholder farmers. It would also help people get access to fruits and vegetables. And I do think we can do that with technology. Couldn't do that otherwise. So we're really looking forward to a future where there will be more healthy living and build a movement towards that in India. On the couple questions that have been asked, I'll try and answer them in the chat, but thank you.
Thank you, Nalini. Thanks for sharing your aspirations. And I think it's the appropriate time to really work with companies, build that dashboard. I think data collection and data mining becomes an important aspect. So thank you for sharing. Moving to Abhinav. Abhinav, what does the future of folk music look like, living with COVID and playing with technology?
Yeah, uh, I'll combine your question with Banerjee's question that they have asked in the chat panel. So we are essentially right now, we are a music label. Okay, music label, the work of the music label is just to produce the music. To distribute that music on different OTT platforms, for example, on the cloud, say Ghana, Savan, you need to partner with a distributor, and then they take the tracks from music label and they put it on these platforms. It's their responsibility to collect the royalties, give it to the music label, and then music label give it back to the artist. So what happens in folk domain, because the these tracks are not so famous and the artists are very freelancers because they work for a number of groups. No distributor or music label signs up with these artists. Okay, for example, if Sony has to sign up with a music label with a artist, they'll only sign up with, say, Mame Khan, and because he's really famous and his tracks will generate a lot of royalties. Or Sony will partner directly with Anath Foundation because we have tracks in bulk. So what we are doing in post-COVID phase, we are designing a technology where we are giving artists an opportunity to distribute their tracks by themselves. This is because right now the artists, they have to depend on Anhad to get their music produced, and then we'll distribute their music. So we are basically decentralizing Anhad in whole, and we are creating a technology which is open source and giving the power of Anhad to the artist. Why not artists can produce the music themselves and distribute it by themselves? So for this thing, we are creating an app. This right now, we have just finished designing the Android version of the app. The app is very simple. The artist will log in the app. They will upload their recorded music in the app, and there is an also option to connect their bank accounts or Paytm wallets. As soon as they hit submit, that track will be distributed automatically to the different streaming platforms, and they'll have real-time data analytics of the number of royalties they are collecting, and it will 100% of the royalties will go to the artist's account. So this is something we are doing in this post-COVID phase, or like in this COVID phase, to empower the artists through technology. And this is, we are taking this period as an opportunity, because right now artists themselves are very keen in finding the solution, and they're sitting at their home, and they are spending a lot of time if we are telling them that okay, you need to learn this kind of technology. So we are helping artists over, even on the telephone, how to like record the music, to even like produce the music by themselves. So this is like one step. And secondly, what we are doing, we have identified some good young music producers in different cultural domains of our country, and we are calling them for a fellowship program in Anhad, a 3-month fellowship program, and we'll be training them how to produce quality music. And we have partnered with 2-3 companies like Sony, is Niger, and we are designing some very portable kind of handy recorders for them. So we'll be training these producers, and we'll be handing over these recorders to them with some special miniature microphones. And it will be the job of these producers after graduating from ANA to go back to their villages and start like producing music in their like locality, and like upload it through the app. So this is a kind of experiment that we have started. We don't have like a foolproof action plan at how is it going to work. So, but this is something that we have started as of now.
Thanks for sharing, Abhinav. The future does look promising. I think my key takeaway from your sharing is how you have to make the artist powerful, or take the initiative to participate with technology. I think that's one way to bridge the digital divide, right? Previously, there was no urgency. So thanks for sharing. Over to Ibu Uni. I know the field of differently abled and home-based rehabilitation and therapy, sometimes technology is not the answer to solving the problems. There are other challenges like the inhuman engagement. So, how are you seeing the future of YPK Bali in the next few years?
Right, thank you, Rajesh. I guess because of the uncertainty that exists currently, we have thought that the efforts to respond to the pandemic must be changed. Our organization needs to strengthen its operation system, and we are thinking a source of information and home guidelines in a digital platform must be prepared, especially for the family and the disabled people. So if the pandemic or another restriction happen again in the world, or I mean in Bali or Indonesia, the disabled people can undertake their therapy exercise at home or anywhere possible. I mean, they are ready, not just like the last 8 months. It was tough, so hopefully they can be more ready to face the future. So in the future, YPK Bali will be changing the system of its operation by maximizing the digital platform. Or now we are working to develop our own mobile phone application. I guess to give you more better example, like I think all the people here are familiar with fitness mobile phone application or home workout. So things like that we are working now, but in some of the home exercise program for the disabled people. So this mobile phone application, the aim is to ensure that quality rehabilitation and education services are available and accessible for all. We want to that our services not just benefit for our clients or for the people that reside in Bali, but hopefully will be for people across Indonesia, or maybe for the people around the world. So yeah, we want that people with physical disability to be part of the digital society. So we want to leverage the digital platform and integrate into our programs and all the services. Rajesh.
Thank you, Ibu Uni. I think just listening to Nalini, Ibu Uni, and Abhinav, there is this urgency to build those applications, to shift the mindsets of your target beneficiaries, get them on board, collaborate. And I'm really amazed to see that optimism coming from the three of you. I think we're almost at the end of the panel, and to wrap up, I call
Yes.
on the last question to Maskandar. Maskandar, what is the blueprint for disaster management when it comes to COVID, and what is the future for Kapala?
Thank you. Yeah, in the future, Kapala, because the community is already familiar with the first touch up of the technology, we want the community to be developed more because this is a big opportunity because they already familiar with the small technologies such as Zoom, as Google. So we could develop bigger so the community could use the technology to document the past process of the disaster that occur in their history, so they could learn bigger about the history, so they could develop the future of the community itself. So we learn so much from the Aceh tsunami. The Aceh tsunami, the community have their own song, their own traditional song that could be used for the campaigning about the dissemination of the tsunami or even tsunami early warning process. So the community could understand that this time to evacuate now if the song is already played by the community. So that kind of story must be documented by the community. So we must train the community to be more using the technology to be familiar with them. So this already um, a big start for us because if in the past we use the radio or even radio transceiver, why not in this era we could use the Google or even Google Form or even Zoom to meet the community or even the people, the key person that having the biggest biggest opportunity to tell the story, tell the traditional story that could be using for the dissemination of the knowledge or even the coordination for the people to build a more resilient community. Thank you, Pratis.
Thank you very much. And I think I'm actually amazed by all your sharing. It just showcases the optimism. It showcases how we are resilient and how our target communities also are resilient, right? With that, thank you very much. This was a short panel. It was a rapid fire one. There were many spin-off questions that were emerging from your sharing, uh, but we hope we can connect again.